I'm rolling in a new feature. It is called Tuesday Tidbits. We're going to get you in and out of here in 5 minutes or less. Today's topic is fetal movements. Fetal movement counts. These are an easy, low-risk, low-cost way to check in on how your baby is doing while you are pregnant. However, the standardization in how we are educating people and what we are educating people to do if they think they have a decrease in fetal movements or when they should do fetal movements, it's sort of lacking. So we're going to go over a bit of that information today. If it's you that's expecting, congratulations, but you are likely going to be the first person that is feeling your baby's movements. Now, if you haven't had a baby before, this is likely going to happen for you between 20 and 22 weeks, somewhere in there. But if you have had a baby before, it's likely that you might feel these baby movements a little bit earlier, maybe around 16 or 18 weeks of pregnancy. Now, as for monitoring your baby's patterns of movements and really paying attention to them as an indicator of your baby's overall health status, this usually is going to start around 28 weeks of pregnancy in a healthy, low-risk pregnancy. But if you are high risk or you are carrying multiples, your provider will likely tell you to start monitoring your baby's movements around 26 weeks of pregnancy. The reason we encourage you to pay attention to your baby's movements is because there has been some correlation between a change in baby's regular patterns of movements and poor outcomes. Namely, we are trying to reduce the incidence of stillbirth. I'm going to go over some common myths in just a second, but the big take home that I want you to grab from this video is that any change to your baby's regular patterns of movements should be looked into. Now, this could be a decrease in fetal movements. That's, of course, a big red flag, but this could also be maybe weaker movements or less movements when your baby is usually active. This could also be an unusual rapid increase in baby's movements. Anything that is different from what your baby normally does at that time of day warrants an investigation or at least letting your provider know, and I will link some resources in the caption for you. Let's talk myths. Myth 1, your baby's movements, they will slow down towards the end of pregnancy because your baby, runs out of room. Huge misconception. Your baby's movements should stay the same number and stay the same pattern. Now, the characteristics, that might change. They may go from more of the rolls to more little jabs and punches because they can't do those complete somersaults, but they should still be moving and they should still be continuing to move in a pattern that is normal for them. And again, any change in that pattern of movements should be investigated. Myth 2, hiccups count towards baby movements. Hiccups are really common for people to experience while they are pregnant, but they are involuntary movements. So they won't count towards a fetal movement count like more purposeful movements will, like the kicks and the rolls and the punches and the jabs. So please keep that in mind. And myth 3, at-home fetal Dopplers can replace fetal movement counts. Those at-home fetal Dopplers, the ones that you put on your belly and you can listen to baby's heart rate, I agree, it's sometimes really nice to hear your baby's heart rate. However, it can sort of give you a false sense of security because that small snapshot in time when you're listening to baby's heart rate, that's not actually going to tell you about your baby's overall health status like fetal movements and a proper assessment could. Also, we don't want to just know that baby has a heart rate. We want to know what's that heart rate like in relation to what's going on around baby. So again, if you are ever detecting a decrease or a change in baby's movements, instead of reaching for the Doppler, reach for the car keys or for your partner and drive yourself into the hospital to be checked out. Now, if you do detect a change in your baby's regular patterns of movements and you go into the hospital to get checked out, you will likely be connected to the fetal monitors to have an NST done. And if you have any questions about what an NST is, I'll link a video up there that'll go over all of it.
All right, here's how to count your baby's movements. First, pick a time of day that you can stay somewhat consistent in being able to relax and focus on your baby. Or if your baby is consistently active at certain times of day every day, that's a great idea to do your kick counts then. Then you want to get comfy. So elevate your feet, or even better, lay on your side and minimize distractions, and then you can focus in on what you are feeling. Get comfy cozy. Then make note of the time and place your hands on your belly and start counting. In the US, 10 movements is what you're looking for, and in Canada, you're looking for 6 movements, and you want your baby to achieve that in 2 hours time or less. Though this is a number to keep in mind, what's incredibly important is learning about your baby's patterns of movements, and then you can tell if there's any change. You can do this by journaling or with apps that are available on smart devices, and there are a lot of them, but I do love Count the Kicks. And no, this is not sponsored. I just really love them because it's simple to use, it's free, and it's available in multiple languages. Now, to use this, you're going to lay down and start the app up, and then you touch the foot anytime you feel a movement, and when you get to 10, the app actually tells you how long it took, and it's also going to ask you to rate the strength of the movements, so you have all of that info if you ever need to look back.